My free theme is about leukemia. Well, we're gonna to start with the get ready. The first question is, what are the cells of the blood? My answer is the cells of the blood are the red blood cells, white blood cells, and the platelets. What do you think are the important cells in this cancer? The answer is the most important cells in this cancer are the white blood cells.
Reading. What is leukemia? Leukemia is a cancer of the blood cells. There are several broad categories of blood cells, including red blood cells (RBCs), white blood cells (WBCs), and platelets. Generally, leukemia refers to cancers of the WBCs. WBCs are a vital part of your immune system. They protect your body from invasion by bacteria, viruses, and fungi, as well as from abnormal cells and other foreign substances. In leukemia, the WBCs don't function like normal WBCs. They can also divide too quickly and eventually crowd out normal cells. WBCs are mostly produced in the bone marrow, but certain types of WBCs are also made in the lymph nodes, spleen, and thymus glands. Once formed, WBCs circulate throughout your body in your blood and lymph fluid that circulates through the lymphatic system, concentrating in the lymph nodes and spleen. In this case, the vocabulary will be broad, that the meaning is having an ample distance from side to side. Throughout, that the meaning is to push, move, or force out of a place or situation by filling its space. Lymph nodes, like the meaning is each of a number of small swellings in the lymphatic system where lymph is filtered and lymphocytes are formed, and spleen. Spleen is an abdominal organ involved in the production and removal of blood cells in most vertebrates and forming part in the human system. What role does the immune system play in leukemia? The immune system plays an important role in protecting the body from disease and possibly cancer. An alteration or defect in the immune system may increase the risk for developing leukemia. Factors such as exposure to certain viruses, environmental factors, chemical exposures, and infection have been associated with damage to the immune system, but none of these factors has been definitively linked as a cause of childhood leukemia. It's important to understand that leukemias most often occur for no known reason, and in nearly all cases, its cause cannot be determined. There's nothing that you could have done or avoid doing that would have prevented the disease from developing. In the majority of childhood leukemias, gene mutations and chromosome abnormalities in the leukemia cells occur by chance. The abnormalities found in leukemia cells are not found in the other cells of the body. Reading. Read the text, then mark the following statements as true or false. This cancer refers in the normal levels of white blood cells. The answer is true because the leukemia refers to the normal levels of white blood cells. White blood cells are made in bone marrow. The answer is true. The function of the red blood cells is the protection of the immune system like bacteria, viruses, etc. The answer is false. That function is about the white blood cells.
Vocabulary. Match the words 1 to 5 with the definition A to E. Letter A. The principal blood cells of the leukemia. The answer is white. Letter B. Cancer of the white blood cells. The answer is leukemia. Letter C. People more likely to have this disease. Letter C. Children. Letter D. Blood cells that carry oxygen, mostly known as erythrocytes. Red. The red blood cells. Letter E. In this system, the WBCs protect the body from an invasion like a bacteria or viruses. Immune.
My name is Andrew Place. I'm a pediatric oncologist here at Dana-Farber Boston Children's, and I'm the clinical director of the Hematologic Malignancy Program, where we take care of children and young adults with leukemia and lymphoma. Childhood leukemia is a cancer of the blood. It's actually a cancer that develops in the bone marrow, which are the hollow spaces in many of the bones in our body. There are several different types of childhood leukemia. Acute lymphoblastic leukemia is the most common type of leukemia and cancer we see in our program, and this commonly affects children ages 2 to 4 years old. The second most common type of acute leukemia is acute myelogenous leukemia. This leukemia presents often in very early childhood, in children less than 1 year of age. Typically, patients can have a history of being very fatigued or being very pale. Other times, patients can develop rashes or have other signs that are more serious, such as abnormal bleeding. Other symptoms include limping and occasionally fevers. Should your child develop any of these symptoms, it will be important to discuss these with your pediatrician.
Listening. After hearing the audio, complete the following. Number 1. Leukemia develops in bone marrow. Number 2. The most common leukemia is the acute lymphoblastic leukemia. Number 3. ALL affects children about 2 to 4 years old. Number 4. AML presents in very young children. Mention 2 symptoms of pediatric leukemia. The answers could be fatigue, paleness, rashes, bleeding, limping, and fevers.
The vocabulary will be acute is a pain or illness is one that quickly becomes very severe.
My name is Andrew Place.
Paleness,
I'm a pediatric
that
oncologist
is
here at
the
Dana-Farber
state
Boston
of being
Children's, and I'm
pale.
the clinical director
Rash,
of the Hematologic
that
Malignancy
is a lot
Program,
of
where
small
we take
red
care of children
spots
and
on
young
the
adults
skin
with leukemia
and limp.
lymphoma.
To walk slowly
Childhood
and with
leukemia
difficulty
is a cancer of the
because
blood.
of
It's
having
actually a
an
cancer
injured
that
or
develops in the
painful
bone
leg
marrow,
or
which are the
foot.
hollow spaces in many of the bones in our body. There are several different types of childhood leukemia. Acute lymphoblastic leukemia is the most common type of leukemia and cancer we see in our program, and this commonly affects children ages 2 to 4 years old. The second most common type of acute leukemia is acute myelogenous leukemia. This leukemia presents often in very early childhood, in children less than 1 year of age. Typically, patients can have a history of being very fatigued or being very pale. Other times, patients can develop rashes or have other signs that are more serious, such as abnormal bleeding. Other symptoms include limping and occasionally fevers. Should your child develop any of these symptoms, it will be important to discuss these with your pediatrician.